SITREP World Briefing for June 20th, 2026. Israeli strikes hit southern Lebanon on June 20th, killing at least 5 people, less than a day after Israel and Hezbollah agreed to renew a ceasefire, according to Lebanese authorities cited across multiple reports. The attacks came after the truce was presented as a step to halt cross-border fire, with Israel and Hezbollah trading blame for violating the agreement. Residents fled parts of the south as fresh strikes hit communities already strained by months of confrontation between Israel and the Iran-backed Hezbollah movement. By later updates, the reported death toll from the day's attacks had risen to at least 16 in southern Lebanon. Southern Lebanon is strategically significant because Hezbollah operates near the Israeli border there, and each new round of strikes raises the risk that a local clash could unravel into a broader regional confrontation involving Lebanon, Israel, Iran, and the United States. The renewed attacks also carried political weight because the ceasefire had been announced only on June 19th and was meant to prevent the Lebanon front from further destabilizing an already volatile region. When violence resumes within hours of an agreement, it increases pressure on Lebanese authorities, Israeli leaders, and Hezbollah commanders to either enforce discipline or prepare for another sustained cycle of strikes and reprisals. For civilians in southern Lebanon, the immediate consequence was another day of evacuation, casualties, and uncertainty in villages close to the frontier. The Ebola outbreak in DR Congo and Uganda has killed more than 200 people within its first month, according to African public health authorities, with hundreds of additional cases confirmed as response teams try to contain transmission across the two neighboring countries. In eastern DR Congo, Ituri province has emerged as the hardest-hit area, highlighting how a fast-moving outbreak in a conflict-affected border region can quickly become a cross-border emergency for both Kinshasa and Kampala. The health response has also been disrupted by insecurity, fear, and misinformation in outbreak zones in DR Congo, where medical workers say they increasingly fear for their own safety while trying to isolate patients, trace contacts, and maintain treatment centers. Reports also said health facilities have come under attack during the current outbreak, further complicating efforts to keep infected people in care and prevent new chains of transmission. The outbreak is now testing the region's public health capacity not only through case numbers but also through a widening resource gap, with funding pledges reported to be falling short of what responders need on the ground. That matters because Ebola control depends on expensive, labor-intensive measures, including protective equipment, safe burials, laboratory testing, vaccination campaigns where available, and sustained surveillance at community and border levels. In DR Congo and Uganda, where movement across porous frontiers is routine, any slowdown in financing or field operations can delay case detection and make a deadly virus far harder to contain. Sources and the full written briefing are available at sitrepbrief.com.